Violence and safety concerns. An inmate lay motionless on a narrow bunk while officers shouted for response, but the silence inside the housing unit carried further than the alarms that followed. By the time supervisors reached the tier, other detainees were already pressing against cell doors, demanding to know how someone could be injured in a place built to guarantee control. That moment unfolded inside Rikers Island, New York City's main jail complex, a facility long defined not just by confinement, but by ongoing questions about safety. Behind these walls, the story continues. Subscribe, like, share, and comment to follow what happens next. Rikers Island sits in the East River between Queens and the Bronx, holding thousands of pretrial detainees and sentenced inmates, many awaiting court dates that can take months to arrive. Unlike state prisons such as San Quentin Rehabilitation Center in California, Rikers operates as a city jail, processing a constant turnover of individuals entering and leaving the system. That constant movement has long complicated efforts to maintain stability, creating housing units where tensions shift quickly and unfamiliar faces arrive almost every day. For decades, reports from oversight agencies, court monitors, and city investigations have described patterns of violence that challenged administrators and alarmed public officials. If stories like this matter to you, subscribing helps us continue examining the realities behind America's most debated correctional institutions. Rikers has faced repeated scrutiny over inmate-on-inmate assaults, staff use of force incidents, and the overall culture inside certain housing units. Independent federal monitors have documented periods when slashings and fights spiked, sometimes overwhelming available staff assigned to supervise entire tiers. In some years, the number of reported serious assaults rose sharply, prompting emergency policy changes and urgent calls for reform from city leadership. Yet statistics alone never capture the lived experience inside a dorm where conflicts can escalate in seconds and help may not arrive immediately. Unlike Alcatraz Federal Penitentiary, which once held a small, tightly controlled population in isolation, Rikers manages thousands across multiple facilities spread over the island. That scale creates logistical strain, especially when staffing shortages reduce the number of officers available to monitor recreation yards, corridors, and intake areas. Federal court findings have described environments where supervision gaps contributed to delayed responses during altercations between detainees. But supervision was only part of the concern. Investigations also pointed to a culture where some housing areas developed informal hierarchies, influencing who felt safe and who felt exposed. Advocates and legal organizations have repeatedly argued that prolonged pretrial detention itself adds pressure, as individuals face uncertainty about charges and court outcomes. When uncertainty mixes with overcrowding, frustration can surface in ways that challenge even experienced correctional officers. In several widely reported periods, city officials acknowledged that violence levels were unacceptable and pledged structural changes. Those changes included increased recruitment of correction officers, revised training protocols, and expanded mental health services within certain facilities. Mental health plays a significant role at Rikers, where a substantial portion of the population receives psychiatric services. Reports have shown that individuals with serious mental illness have at times been disproportionately involved in use of force incidents. Critics argue that jail environments are ill-equipped to handle complex mental health needs without escalating risk. Administrators, meanwhile, have cited resource constraints and the difficulty of balancing safety with care. The debate intensified after federal authorities concluded that conditions in certain housing areas violated constitutional standards. That finding carried weight because it echoed earlier court interventions dating back decades. In response, city leadership outlined plans to close Rikers entirely and replace it with smaller borough-based facilities. But closure timelines have shifted, and daily operations continue under intense oversight. Within the jail complex, specialized units were introduced to separate younger detainees from older populations after evidence showed higher assault rates among adolescents. Those units aimed to reduce violence through programming and structured supervision. Yet, even with targeted housing strategies, incidents continued to surface in oversight reports. At San Quentin Rehabilitation Center, officials have emphasized programming and rehabilitation as central to safety improvements. By contrast, Rikers pretrial focus limits long-term program continuity, as detainees may leave or transfer before completing courses. That instability affects relationships between staff and inmates, which experts often cite as critical for reducing conflict. Some correction officers have publicly described working mandatory overtime shifts, sometimes extending beyond standard hours. Fatigue, oversight bodies have warned, can impact response times and decision-making during emergencies. City audits have documented occasions when posts were left unfilled due to absenteeism or staffing gaps. In those moments, responsibility for monitoring entire areas could fall on fewer officers than policy recommended. But staffing shortages were not the only factor shaping safety concerns. Internal reports also examined how contraband entered facilities, including improvised weapons later used in altercations. Administrators increased searches and screening measures, attempting to limit access to dangerous items. Still, confiscations did not fully eliminate incidents. Public hearings at City Hall brought testimony from former detainees describing fear during recreation periods and nighttime hours. Correction officials countered with data showing periods of decline in certain categories of violence after reforms were introduced. The numbers sometimes improved, but the perception of instability persisted among advocates and families. Each new reported incident reignited debate over whether incremental reforms were enough. And as oversight intensified, another question began to surface about what deeper structural issues remained unresolved. Oversight findings eventually shifted from isolated incidents to patterns, describing recurring breakdowns in supervision that allowed conflicts to escalate before officers could intervene effectively. Monitors noted that some housing units operated for extended periods without consistent leadership presence, weakening accountability and blurring lines of responsibility when force was used. When incidents were reviewed, documentation sometimes lacked clarity, making it difficult to determine whether policy had been followed or whether intervention occurred quickly enough. That ambiguity deepened distrust among detainees who believed complaints would not be investigated thoroughly, even when injuries were formally recorded. City officials responded by expanding body-worn camera programs, requiring officers to document interactions more consistently inside certain facilities. The goal was transparency, but implementation revealed another challenge. Footage required review, storage, and staffing resources already stretched thin. Meanwhile, detainees continued navigating daily routines shaped by unpredictable movement schedules, court transports, and last-minute housing changes. Frequent transfers between units disrupted informal stability, sometimes placing individuals with unresolved disputes back into shared spaces. Advocates argued that classification systems failed to fully account for gang affiliations or personal conflicts documented during intake. Administrators countered that classification is an evolving process, adjusted continuously as new intelligence becomes available. But real-time intelligence depends on communication, and communication often breaks down in overcrowded environments. Several years ago, federal prosecutors outlined concerns about a culture that discouraged officers from reporting excessive force by colleagues. Union representatives strongly disputed those claims, emphasizing the dangers officers face while supervising volatile populations. Tension between reform advocates and correction staff has shaped nearly every public conversation about Rikers. When staff morale declines, recruitment suffers, and vacancies widen existing gaps in supervision coverage. Those staffing gaps became especially visible during periods when absenteeism spiked and emergency posts went unfilled. City audits documented entire housing areas operating below recommended officer-to-inmate ratios. Under those conditions, even routine disputes over commissary items or phone access could escalate without immediate mediation. Mental health clinicians assigned to certain units reported difficulty maintaining consistent therapeutic engagement amid lockdowns triggered by violence. Lockdowns restrict movement, confining detainees to cells for extended hours while investigations unfold. Extended confinement can intensify frustration, particularly for individuals already coping with anxiety or untreated trauma. Medical providers have testified that untreated stress inside jails often manifests in impulsive behavior. That dynamic complicates safety strategies focused solely on physical security measures. Rikers has attempted to expand conflict resolution programming, including structured group sessions and peer mediation initiatives. However, Participation fluctuates as detainees transfer or return to court appearances that alter their housing status. Unlike long-term facilities such as San Quentin Rehabilitation Center, where inmates may serve decades, Rikers manages a population defined by uncertainty. That uncertainty feeds impatience, and impatience sometimes fuels confrontation. Public data releases showed moments when slashings decreased after targeted interventions, including enhanced searches and revised recreation schedules. Yet those improvements were often followed by new spikes in other categories of assault. Observers began asking whether the island's physical layout itself contributed to safety risks. The complex includes multiple aging buildings connected by roadways, requiring transport vehicles to move detainees between facilities. Each transfer creates an opportunity for tension, particularly when rival groups cross paths during intake or court returns. Security experts have noted that older infrastructure can limit sightlines, complicating supervision. Modern correctional design often emphasizes direct supervision models that keep officers inside housing units rather than stationed behind barriers. Implementing that model at Rikers has proven difficult due to architectural constraints and staffing shortages. Meanwhile, outside the island, political pressure mounted to accelerate closure plans. City leaders announced intentions to replace Rikers with borough-based facilities designed around smaller populations and modern safety standards. But construction delays and budget debates slowed progress, leaving the existing complex operational longer than initially promised. As years passed, families of detainees continued filing lawsuits alleging preventable harm. Some cases resulted in settlements, while others prompted additional court oversight. Every settlement reinforced the central question: why did similar patterns keep resurfacing despite reform efforts? Correction officials pointed to incremental gains, citing reductions in certain violent incidents compared to previous peak years. Critics argued that incremental gains were insufficient when serious injuries still occurred. The conversation often circled back to staffing, infrastructure, and mental health capacity. But beneath those structural debates remained a deeper concern about institutional culture. Culture influences how quickly officers respond, how detainees report threats, and how leadership enforces accountability. Changing culture requires time, consistent leadership, and trust built through daily interactions. Trust, however, is fragile in environments shaped by confinement and authority. And as oversight reports continued documenting both progress and setbacks, few outside the island fully understood how fragile that balance remained. In the years that followed, independent monitors continued filing detailed reports outlining both measurable improvements and persistent failures inside Rikers Island. Some indicators showed modest declines in specific categories of violence after policy adjustments were enforced more consistently across housing areas. Yet other metrics revealed troubling increases, particularly during periods marked by severe staffing shortages and operational instability. City officials acknowledged that absenteeism among correction officers had reached levels that strained the system beyond sustainable limits. Emergency declarations were issued at times, allowing temporary measures intended to stabilize supervision and reduce immediate risks. Those measures included suspending certain non-essential movement and reallocating available officers to the most volatile housing units. But restricting movement carries consequences, especially when detainees spend extended hours confined without programming or recreation. Advocates warned that prolonged lockdowns, even when imposed for safety, can intensify tension rather than resolve underlying conflicts. Medical staff reported rising requests for mental health consultations during prolonged confinement phases. At the same time, officers described managing units where frustration escalated quickly during limited recreation periods. When movement resumed after restrictions, disputes sometimes resurfaced with renewed intensity. City leadership expanded recruitment campaigns, offering incentives to attract new correction officers. Training academies emphasized de-escalation strategies and crisis intervention techniques designed to reduce use of force. However, training alone cannot immediately offset years of institutional strain. Oversight bodies stressed that accountability systems must function consistently to restore trust inside housing areas. Body-worn camera expansion aimed to improve transparency, but reviewing footage requires time and administrative resources. Disciplinary proceedings involving staff or detainees can take months, prolonging uncertainty. Meanwhile, detainees awaiting trial continued entering the system daily, replacing those released or transferred. High turnover complicates efforts to establish stable peer networks that might otherwise discourage violence. Unlike long-term state facilities such as San Quentin Rehabilitation Center, Rikers rarely houses individuals long enough for extended rehabilitative engagement. San Quentin has increasingly focused on education and reentry preparation as part of broader reform initiatives in California. Alcatraz Federal Penitentiary, by contrast, operated under an entirely different model during its years in service. Alcatraz held a comparatively small population under strict federal control, limiting movement and minimizing interpersonal contact. Its isolation in San Francisco Bay created physical separation that reduced outside interference but also intensified psychological strain. Rikers, situated within New York City, functions at the intersection of urban pressures and correctional responsibility. Its proximity to courts and communities ensures constant interaction with the broader justice system. That proximity also amplifies public scrutiny whenever incidents occur. Civil rights organizations continue to monitor conditions closely, often releasing independent analyses alongside official data. Union representatives for correction officers argue that public narratives sometimes overlook the risks staff face daily. Officers have been injured in altercations, reinforcing their calls for improved staffing and infrastructure. Safety inside any correctional facility depends on a balance between supervision, services, and accountability. When one component weakens, the others face additional pressure. In recent years, city leaders reaffirmed commitments to closing Rikers and constructing smaller borough-based facilities. Supporters of closure argue that new buildings designed around direct supervision models could reduce violence significantly. Skeptics caution that new construction alone cannot transform institutional culture without sustained policy reform. Budget constraints and political negotiations continue shaping timelines for that transition. As debates continue, detainees and staff navigate daily routines within existing structures. Court monitors have emphasized measurable benchmarks that must be met to demonstrate lasting improvement. Those benchmarks include reduced assault rates, timely investigations, and improved access to mental health care. Progress toward those goals has been uneven. Some facilities within the complex report better outcomes than others, suggesting localized leadership can influence results. Still, island-wide consistency remains elusive. Community groups advocate expanded alternatives to pretrial detention, arguing that reducing population pressure could improve safety. Pretrial reform initiatives have already lowered overall jail populations compared to earlier decades. Yet even at reduced levels, management challenges persist. Each reported incident reinforces the urgency felt by families awaiting reform. Each incremental improvement suggests change is possible but fragile. The story of violence and safety at Rikers Island is not defined by a single statistic or isolated event. It is shaped by structural constraints, policy decisions, human behavior, and sustained public attention. As long as the facility remains operational, its safety record will remain central to conversations about justice in New York City. And while comparisons to San Quentin Rehabilitation Center and the long-closed Alcatraz Federal Penitentiary provide context, Rikers stands alone in its unique challenges. Its future remains uncertain, but the demand for accountability continues. If this story kept you watching, the next one will stay with you even longer. Subscribe for more real prison documentaries. Even as reform plans move forward, daily life inside Rikers Island continues under the weight of expectations shaped by years of federal oversight and public scrutiny. Supervisors now conduct more frequent walkthroughs, documenting conditions inside housing areas to demonstrate compliance with court-ordered safety benchmarks and internal accountability standards. These inspections focus on staffing levels, response times, and whether officers are positioned where policy requires direct supervision rather than remote observation. Documentation has improved on paper, but translating written compliance into lived safety remains a complex and ongoing challenge. Independent monitors have repeatedly emphasized that consistency, not temporary crackdowns, determines whether violence declines in a meaningful and lasting way. Short-term enforcement surges may suppress incidents briefly, yet sustainable improvement depends on stable leadership and predictable routines. Predictability inside a jail environment reduces uncertainty, and reduced uncertainty often lowers the likelihood of impulsive confrontations. At Rikers, unpredictability historically stemmed from sudden housing transfers, unexpected lockdowns, and fluctuating staffing coverage across shifts. Recent administrative strategies attempt to stabilize unit assignments, keeping officers and detainees in consistent placements whenever operationally possible. The intention is to build familiarity, allowing staff to identify brewing conflicts before they escalate into documented assaults. Familiarity can also encourage detainees to report threats discreetly, trusting that concerns will not automatically trigger punitive consequences. Still, building trust inside a correctional setting requires time measured in months and years, not press conferences. City officials continue releasing periodic updates on violence indicators, comparing current figures against previous reporting periods. Some categories show measurable declines compared to earlier peaks, while others fluctuate in response to population changes. Advocates caution against celebrating incremental progress without acknowledging individuals still harmed during transitional phases. Correction leadership argues that progress should be recognized to maintain morale among officers tasked with implementing reforms. Morale influences performance, and performance directly affects how quickly officers intervene when disputes arise inside crowded dormitories. Comparisons to San Quentin Rehabilitation Center often surface in policy discussions about culture change within correctional institutions. San Quentin's recent emphasis on educational programming reflects a philosophy that structured engagement can improve institutional safety. Rikers' shorter detention cycles complicate replicating that model, though pilot programs attempt to expand structured activities. Alcatraz Federal Penitentiary remains a historical contrast, remembered for rigid control rather than rehabilitative ambition. Its closure decades ago underscores how correctional philosophies evolve alongside public expectations and legal standards. Rikers now sits at the center of a similar turning point, where policy decisions will determine its remaining years of operation. Construction of borough-based facilities is underway, though timelines remain subject to funding approvals and political negotiation. Proponents argue that smaller facilities integrated into communities could reduce isolation and improve oversight transparency. Critics question whether new buildings alone can resolve staffing shortages and entrenched cultural challenges. Meanwhile, detainees continue arriving daily, bringing with them unresolved court cases and personal histories that shape behavior. Every intake represents another test of classification systems designed to prevent known conflicts from resurfacing. When classification succeeds, potential violence may be avoided quietly, without headlines or emergency responses. When it fails, consequences unfold quickly, often prompting renewed calls for structural overhaul. Federal monitors have stated that sustainable safety depends on measurable accountability at every supervisory level. That accountability includes timely investigations into use of force reports and transparent disciplinary outcomes when policies are violated. Transparency builds public trust, yet it also exposes shortcomings that demand further corrective action. As long as Rikers Island remains operational, its safety record will continue influencing broader debates about incarceration in America. The outcome will not hinge on a single reform, but on whether cumulative changes create an environment where violence steadily declines. For now, the island stands as a reminder that correctional safety is never static, and progress must be defended every day. Long after headlines fade, the daily rhythm inside Rikers Island continues, defined by counts, movement schedules, and constant assessments of risk across its separate facilities. Each morning begins with verification, officers confirming presence in every cell and dormitory, a process designed to establish order before tensions have an opportunity to surface. These routine counts are simple in theory, yet any discrepancy can trigger lockdowns that ripple through entire housing areas within minutes. Lockdowns halt movement to medical clinics, court transports, and recreation, compressing frustration into confined spaces where patience is already limited. Administrators argue that decisive lockdowns prevent wider disturbances, while critics contend that repeated restrictions heighten volatility among detainees awaiting resolution of their cases. The balance between swift control and measured response remains one of the most contested operational decisions inside the complex. Data analysts within the Department of Correction track incident reports daily, searching for patterns that might signal emerging conflicts. Those patterns can include disputes tied to housing assignments, commissary access, or perceived favoritism in work detail placements. When trends appear, leadership may reassign staff, separate individuals, or adjust recreation groupings to reduce contact between rival groups. Such adjustments often occur quietly, without public announcement, reflecting an effort to intervene before violence escalates into serious injury. Yet intervention depends on accurate information, and information inside correctional environments is not always complete or timely. Detainees may hesitate to report threats, fearing retaliation or believing complaints will not change their circumstances. Officers, managing multiple responsibilities simultaneously, must interpret incomplete signals while maintaining authority across diverse populations. This constant calculation defines safety at Rikers more than any single policy reform or public directive. Comparatively, San Quentin Rehabilitation Center operates with longer-term programming that allows administrators to observe behavioral patterns over extended periods. Rikers' shorter detention cycles compress that observational window, limiting opportunities for gradual behavioral intervention. Alcatraz Federal Penitentiary once relied on isolation and strict routine to minimize interpersonal conflict among a small federal population. Modern correctional standards reject prolonged isolation as a primary management tool, emphasizing constitutional safeguards and mental health considerations. Rikers therefore operates within contemporary legal frameworks that restrict certain disciplinary approaches common in earlier eras. These constraints reflect evolving societal expectations, yet they also require creative alternatives for maintaining safety. Expanded mental health staffing represents one such alternative, with clinicians embedded in housing units to address crises early. When clinicians respond promptly to escalating distress, they may prevent incidents that would otherwise require forceful intervention. However, mental health resources face the same staffing pressures affecting correction officers, creating service gaps during peak demand. Budget negotiations at the city level influence hiring capacity, equipment upgrades, and facility maintenance schedules. Aging infrastructure complicates maintenance, with plumbing failures or ventilation issues sometimes contributing to tension inside crowded dormitories. Environmental stressors, though rarely highlighted in public debate, shape daily experiences that influence behavior. Lighting levels, noise, and temperature can affect sleep patterns, and disrupted sleep correlates with increased irritability. Administrative reforms increasingly acknowledge these subtler factors, though retrofitting older buildings remains costly and time-consuming. Community oversight boards review quarterly data, questioning department officials about progress toward violence reduction benchmarks. These hearings generate public accountability, yet they also illustrate how complex and incremental meaningful change can be. Families of detainees attend such hearings, pressing for assurances that loved ones will remain safe while awaiting court dates. Correction officials respond with statistics, policy summaries, and commitments to continued reform implementation. Statistics provide context, but personal experiences often carry greater emotional weight in shaping public perception. Media coverage amplifies high-profile incidents, reinforcing Rikers' long-standing reputation as a troubled institution. At the same time, many days pass without major disturbances, a reality less likely to attract attention. This contrast between headline moments and routine stability complicates assessments of overall safety. Experts caution that reducing violence is not synonymous with eliminating it, particularly in high-turnover jail settings. Sustainable improvement requires stable staffing, effective classification, accessible services, and consistent leadership. Each of these components interacts with the others, forming a network rather than a single solution. As construction of replacement facilities progresses slowly, Rikers remains operational, carrying both its history and its reform ambitions. Whether future borough-based jails will resolve long-standing safety concerns depends on how lessons from Rikers are applied. For now, the island stands as an ongoing case study in the challenges of managing large urban detention systems. Its story is neither static nor concluded, shaped daily by policy decisions, human judgment, and the enduring demand for accountability.